Hi, my name is Mick Rage. I'm the president of Vachette Pathology and Stark Medical Auditing. We started this company back in 2002 with the concept of looking how physician practices make money. We don't do billing, we audit billing, and we look at revenue. A big issue with revenue now is value, and the value changes come forth for next year. Even with the current election, the past industry changes are going to take place. So before we know what's going on, let's talk about where we're at right now and what we can do next year for our practices, our labs, and our hospital groups that we work with. Okay, with me today is Alex Mitchell. He's our value practice manager. He works with all our practices on value and the MIPS and macro changes that are coming for next year. He's the guy that's going to keep people from losing money next year, and he's the person we're going to hook up with your practice when you have questions. Alex, tell us what we have on the table for next year and how groups can prevent these penalties from taking place.
Yeah, well, under MACRA is MIPS, and that's the merit-based incentive payment system. And what pathology groups are going to need to, without diving too far into the weeds, what pathology groups need to understand is that they're going to be considered non-patient facing under MIPS, which means they're going to have less in reporting burdens from other primary care physicians and possibly other specialties because they don't have those face-to-face interactions with patients. And that benchmark's being set at 100 patient-facing interactions each year.
So if our group sees less than 100 patients face-to-face, they're a patient-facing group.
That's correct. Okay. And almost all pathologists are going to meet that mark unless they're being assessed with other specialties as part of a hospital, which will be rare instances, but something we could certainly help you work through.
Okay.
So what you need to understand as a non-patient-facing specialist is that you'll only be assessed next year in two portions of the merit-based incentive payment system, and that's quality, which will be 85% of your score, and a new category they're calling clinical practice improvement, which is they're going to be looking for you to swear that you've taken steps over a continuous 90-day period to help improve either the access that you're providing patients to the doctors in your group, the communications of your test results to those patients, different activities like that.
All right, so quality is going to be replacing PQRS, basically.
That's correct.
It's the same concept.
Yes.
And they have to meet one metric there, I believe?
Well, yes, you're right about that, actually. For next year, MIPS is taking a transitional approach. So what they'll be doing is only requiring that doctors submit at least one metric to avoid a penalty in 2019. Okay. And it's just like PQRS, where you have the performance year and then a 2-year gap before you either see your penalty or bonus. So with MIPS going into place next year in 2017 for the first time we'll see those penalties will be in 2019.
Okay.
And so they're trying to make that penalty for 2019 very easily avoidable by just requiring that you attempt to do your reporting next year.
Now, we have a lot of groups that seem to be getting letters because they didn't do it right 2 years ago. You know, my fear is that 2 years from now, these groups will be penalized even more. Isn't it a 4% penalty in the next 2 years?
It will be. The first maximum penalty that you could be assessed on for 2017 will be a 4% hit.
And do you know any businesses that could go without 4% of their income?
Well, I certainly wouldn't recommend it.
Yeah, we're seeing this struggle across the nation with various practices, with laboratories. We're getting a lot of phone calls. We have a great PowerPoint on this. If you call us or you email us, we'll get it to you directly. Anything else? One more comment from you, maybe something they could do, especially going forward. What about this attestation for Medicare for coverage under the clinical practice improvement?
Yeah, well, that's going to be the other portion of it. And again, if you just next year report one quality metric or one improvement activity, that's going to be how you avoid your penalty, guaranteed, even if you don't score well in that. That's how simple they're making this for the 2017 performance year. So for the practice improvement activities, one of your options for reporting those is to attest through CMS's website that you've completed it. And that will we're still waiting for some additional guidance on exactly how you'll do that, but we know right now that that'll require you documenting through 90 consecutive days that you've performed the activity at least, and signing to CMS swearing that the documentation you provided is correct and truthful.
Good.
So, just to say one additional thing, if you're already reporting PQRS and doing well in it, next year you should definitely try to do the full reporting, which would be reporting 6 quality metrics for at least 50% of your Medicare patients if you're reporting via claims, or all your patients if reporting through another reporting mechanism. And if you're already doing well in PQRS, even though you may not be able to receive a large bonus in 2019 for this initial year, you'll at least hit the ground running so that you'll be well prepared in 2018 when the reporting requirements go up.
Good. Well, we're going to see a lot of these changes taking place. And who knows what's coming in the next 6 to 12 months. As an expert who spends his life traveling the nation, talking to pathology groups, the laboratories, and other hospital-based groups and hospitals about healthcare and the changes taking place, I see the next 12 months as being vital to being on top of this. You will get letters. You will lose 2, 4, 6, 7, up to 20% of your income if you don't do this right. So my advice is take a look at our website. We'll have it all laid out there for you. It's VachettePathology.com or StarkMedicalAuditing.com. They're both on there. There's an 800 number on there. Give us a call. Call us at the office. We'll send you information. If you send us an email, we'll send it to you free of charge. Try to help you update that. And another thing I'll offer, if your state society wants someone to come spend 15 or 20 minutes on this during their state show, we'd be happy to come out free of charge to sit down to try to help everyone understand this as we move forward. Again, I'm Mick Raich, and this is Alex Mitchell. We're from Vachette Pathology and Stark Medical Auditing, and we thank you very much for your time.